Hi, everyone. Today we have Dr. Wesley Ely with us. Dr. Ely is a pulmonary medicine and critical care specialist and professor at Vanderbilt University Medical Center. He is most well known for his research and advocacy work in post-intensive care syndrome, also known as PICS, and the neurological effects of long COVID-19. In 2022, he also won the Christopher Award for Literature for his book, Every Deep Drawn Breath. His biography is under this video. Welcome, Dr. Ely. And now just moving on a little bit, obviously since COVID-19, I know you've been doing a lot of active research behind long COVID as well. And so can you share with us a little bit about the phenomenon that you're seeing there behind long COVID-19?
Yes, and what a privilege it is for me to essentially become repurposed as a scientist into this new disease process. And I did not come to this easily, April. I came kicking and screaming because I really didn't believe it as an entity. You know, as a medical insider, we'd seen so many negative studies on things like ME/CFS with his myalgic encephalomyelitis chronic fatigue syndrome that many of us were doubters. We didn't think it was a legitimate illness. We thought it was psychosomatic, and I was wrong. And I admit I was wrong, and I want to tell people I'm sorry. Yeah. And it's my privilege now to be with you as you're suffering and getting through this. I don't fully understand how you're suffering or the illness, but I won't abandon you. And we'll stay there with you. We'll get through this as we get scientific answers. And what we're doing now is using our research center. We have a center here called the CIBS Center. CIBS stands for Critical Illness, Brain Dysfunction, and Survivorship. And we're using all the tools that we've used over the past 25, 30 years of outpatient neuropsychological testing, outpatient rehabilitation, et cetera. And we're now studying and caring for long COVID patients every day of the week. We have long COVID support groups and COVID survivor spouse support groups, and we have social workers, and we're helping them with disability services, insurance, helping them find housing, jobs. All these things are part of our survivorship endowment, and that plus the design of new randomized controlled trials is how I'm moving forward as a physician scientist.
And so neurologically speaking, what are the most common symptoms that you're seeing again and again, or maybe the less common ones that surprised you?
Well, I was surprised by the magnitude of the neuropsychological deficits that long COVID patients experience. And when we test them with an hour-and-a-half long neuropsychological battery, very consistently, we're finding profound problems with memory and executive function and processing speed. These are the three domains that are so incapacitating to people. They can't remember what they need to do to do their job or get their list at Costco or Target. They are having tremendous problems organizing themselves from an executive perspective. And that doesn't mean you have to be an executive to have problems with executive function. It just means you can't do organizational tasks and lists. And then this issue of processing speed is really bothersome to people, that their brain seems to be swimming in molasses, they say, and it moves so much slower that they know that they're appearing to other people to be disabled. So people are describing, I'm working with the National Academy of Medicine on a long COVID committee right now, and we had a guest from our COVID support group come, and she said, you know, I was an executive, and now it takes me 3 hours to create an email. And I have to triple and quadruple read that email, and I'll send it out, and I'll still have grammatical errors in there. And this was a person who only had mild COVID. She never even got that sick from her COVID, but she has rip-roaring, ongoing neurocognitive deficits.
Right. Wow. It sounds like you're getting a lot of feedback from your patients as well. And so you're really, you know, sort of on the ground with this kind of research. And I just wanted to ask you, you know, with everything that you're doing, as well as the community, you're working in collaboration with a lot of researchers about this. What do we hope to see in the future for long COVID-19? What is the realistic expectation of what we can actually achieve in terms of how we can manage this disease, essentially?
Sure. We've got probably 65 to 100 million people experiencing different degrees of this problem around the world. So this is a global epidemic. It is a public health disaster and it's growing. Many of the people who have long COVID don't even know they have long COVID yet. They just know that they're having a problem in life, but nobody has validated their illness at a medical level.
Yeah.
And many of them are told that they should go see a psychiatrist or a psychologist and get, rehab there. So what I hope happens, and what we're doubling down on, is that we are designing. I just wrote a 470-page grant, for example, to the NIH to get the money to do a double-blind, placebo-controlled trial of an immunomodulator for long COVID. Others are using antivirals for long COVID, and many people are studying the clotting system for long COVID. So all three of those are examples of pharmacological ways that we can try and find answers for long COVID patients. And then in addition to that, now here's a way that PICS, post-intensive care syndrome, and long COVID diverge, is that the PICS patients tend to do pretty well with physical therapy and cognitive rehab, whereas the long COVID patients have tremendous problems with what's called PEM, P-E-M, post-exertional malaise. And so they can't be put through graded exercise rehab programs because it wears them out and knocks them out for a week or two. So one of the non-pharmacological interventions that I think we need to develop and validate for our long COVID patients is graded pacing. How do they pace themselves? And a practical way of thinking about this, April, would be, let's say that I have long COVID and I think, you know what, I'm in a place of health now where I could probably work 5 hours today. And what my patients tell me is, Wes, cut that in half. Instead of working 5, just work 2.5. Or another way of thinking of it is, I am exhausted right now. I think I need to rest a day. And what we do is double that. So instead of resting 1 day, we have them rest 2 days. But this is all right now, just winging it. I would like to study this and prove the right way.
Absolutely. Well, thank you for sharing all of that with us. I think that's all we have for the time that we've got. Very interesting, research that's being done about PICS and long COVID-19. So thank you for being part of all of that. I know you have a lot of resources to share as well, so I'll link them all down below. And thank you so much for being with us today.
Thank you, Dr. Chan.